So I think making the decision to go into an orthopedic walk-in clinic can be, maybe you have a sprained ankle, or you've woken up with some bruising in your knee from a fall from the day before. Maybe you're playing in the yard with your kids and you slip and fell, or maybe even your child has an acute injury. So coming into our walk-ins, all you need is your photo ID and your insurance card, and you just walk right in. At two of our locations, the downtown complex location and our Winter Park location, we have the ability for Saturday walk-in visits from 9 a.m. to 3 p.m. This is so important for those patients who have a busy work schedule, and especially our athletes, the student athletes that may have an injury on a Friday night and they want the ease of their mind knowing into the weekend what their treatment plan might be. Those Saturday clinics are really important.
An orthopedic walk-in clinic offers you something that other urgent care and emergency rooms don't, in that you're going to see someone who's trained specifically in orthopedics. So if you have an injury, such as you might have a fracture or a flare-up of arthritis or a tendon injury, you're going to someone who is trained specifically for that. When you go to the ER, you go to urgent care, yeah, they can do x-rays, they're wonderful, and they can certainly get you going into the right direction, but most of the time you're gonna leave there and they're gonna say, okay, you have to go follow up with orthopedics. And so we sort of take out that middle stop. Many times you can come to see me or one of my colleagues and we can get the x-rays done. We can get advanced imaging ordered if needed. We can put you right in a cast if needed. And if there is something surgical going on, we can get that surgical referral going before you even leave the office. From the diagnostic standpoint, immediately you're most likely going to get an x-ray if you haven't had one already. If you come in with one already, we'll analyze that and potentially get more if needed. And we do a very focused physical exam, depending on what it is. If it's something, an acute sports injury, if you need an MRI or something like that, we can get that set up for you before you even leave the building. If there's something that requires bracing or medication, we can get that going for you. Additionally, if it's something like an arthritis flare-ups, certain things like injections and other treatment things we can do right on the spot. So my favorite part of working at the Orlando Health Jewett Downtown Orthopedic Complex is just the fact that it is truly a one-stop shop for our patients. You can come in, get diagnosed, get treated in many cases, and depending on what you need and what's appropriate, many times you can leave with a prescription in hand. You can leave having already had an MRI or a CT done. You can leave with a surgical referral. It's pretty amazing.